Hey, everybody, Dr. Rob Silverman here. Proven Health Alternatives. I have my esteemed colleague and friend, Dr. Benedikt here. I'm excited to have Howard on. He is going to share some insights into what I believe is the look to the future in a conversation within the idea of the vagus nerve. So it's great to see you. Thanks for coming on.
Oh, it's a pleasure. Thank you for having me. I'm really excited about this topic because it seems like it's really in mainstream functional medicine in terms of looking at this whole gut-brain axis connection.
Oh, I agree with you so much on that, in that you and I in chiropractic itself has been talking about the vagus nerve for years, but I agree with you. It's crossed over the lane into the mainstream where now every practitioner is talking about the vagus nerve. And when we talk about the vagus nerve, we talk about stimulating the vagus nerve. But before we get into the rabbit holes of what we can do to do that, what is the vagus nerve?
Okay, so the vagus nerve is a cranial nerve. And for those of you who are not up to your neuroanatomy, what that means is it's a nerve that comes out of the brain or brain stem and then travels and innervates wherever it's going to go. And the vagus nerve is actually the 10th cranial nerve and is also sometimes referred to as the wandering nerve. So I like to say it's kind of the nerve that whatever happens in the vagus doesn't stay in the vagus because it has such a profound impact on so many different organs and systems in the body.
So the vagus nerve, to recapitulate, is cranial nerve number 10. It goes from the brain, or if you will, the brain stem, the medulla oblongata, down through the transverse colon. I know you're going to really exemplify how it is the key element or the key neurological input from the gut to brain and the brain to gut axis. You called it the Great Wanderer because it covers so much landscape. And I like the idea of what happens in Vegas, VAGUS, doesn't stay in Vegas. Outstanding. So what does the vagus nerve do? What's its purpose?
Okay, so until recently, we only talked about one vagus nerve. And then in the early 1990s, a theory was proposed that there actually are two components of the vagus nerve. One that supplies really in the mouth, the tongue, the jaw, all the way to the heart, more so in the front, and a dorsal part of the vagus nerve that really goes all the way down beyond the diaphragm and into the colon. So you can see it has a lot of different innervations to a lot of different tissues and can have a profound effect on what's referred to now as this gut-brain axis, because researchers wanted to know, how do these chemicals that the body manufactures in the gut, or we know as neurotransmitters, connecting information to the brain, how do they get to the brain? And then it was found out that it's through the vagus nerve, but more importantly, the vagus nerve plays an important role in the management of stress and controlling another system of the body called the autonomic or automatic nervous system. So it's the part of the nervous system that calms you down. You have your stress response, your fight or flight, which is driven by cortisol. And then you have kind of the brake that has to calm that down, and that's the vagus nerve. So you have impulses going from the gut to the brain, and we've all probably used that expression, I feel it in my gut. I have a gut feeling. Well, what does that really mean? Well, there are signals going from your gut to your brain, and there are signals going from your brain to your gut that is now referred to as the gut-brain axis. There are other axes in the body, but this is the one that's received a lot of interest over the last few years.
I really like a couple of terms you use to piggyback on what you said before. It's the autonomic nervous system. It's the balance between the sympathetic and the parasympathetic nervous system. The vagus nerve is the captain of the parasympathetic nervous system. Rest and digest, as you said, wine and dine. We want an appropriate balance. Now, what's interesting is it's like a seesaw. Some people always think it's like a push button. It's not. That balance is a critical element. And as you said earlier, it ties in the gut to brain axis, and it does so, interestingly enough, by the fact that when it attaches to the transverse colon, the vagus nerve, it attaches to something called a neuropod. This neuropod, which was found by Duke University, it's best way for me to describe it is look at my aura ring. This is the outside of your intestinal tract. This is the inside. Here's your neuropod like a paperclip. This is your vagus nerve. So hence your vagus nerve can sense what's going on inside your gut. So it really connects the microbiota to gut to brain axis. So that being said, discuss the role the vagus nerve plays in health and disease.
Well, we really think for me, it's really at the crossroads, because I think every patient that I see in my clinical practice, and I'm sure that is the same with you, Dr. Silverman, come in and they're in some mode of distress or stress. Whether it's physical stress, emotional stress, thermal stress, they're in pain. They've been sick for a long period of time. Their sympathetic nervous system is in overdrive. One of the things that I always stress to other chiropractors is we are key at trying to understand how the nervous system works. That's what chiropractic was based on. We should understand how does the nervous system, or how does the gut and the microbiota or microbiome, whatever term you want to use, how does that communicate with the nervous system through the vagus nerve? So the gas is the sympathetic nervous system on drive, pumping out cortisol. What's the brake? Well, that's the vagus. But over time, if you've ever had a car, what happens? You run out of gas, or your brakes don't work the way they should. So now you're in what's called sympathetic dominance. You're constantly on stress. And how does that affect you? Difficulty sleeping, difficulty digesting. You have problems with the rhythm of your heart. You feel uncomfortable. You're angry. You're not the type of person that should get on the highway, when there's a lot of traffic. You cut off people. And that drives your immune system, your endocrine system, your musculoskeletal system. All of the systems are driven by this overdrive. We need to find a way clinically as practitioners and by educating our patients to return what's called vagal tone, get in balance. So what we use in chiropractic from day one, homeostasis. I always thought that was a chiropractic term. And then when I read more and more literature, they constantly talk about glucose homeostasis, cardiovascular homeostasis, nervous system homeostasis. So it's not a chiropractic term. It's an understanding of maintaining balance in the body. And for me, it's understanding, and especially now seeing so many people who have long COVID, that the vagus might be involved in some way, shape, or form with that.
You made some really great points. Metaphorically speaking, the idea of the accelerator and the brake and balancing
Right.
so you get to the right speed is fabulous. It is a takeaway. It is a salient point without question. The term you use, autonomics, but automatic, it's true. We can't control it. So that's why we want to do specific stimuli to the vagus nerve. And let's talk about the black cloud behind all our heads, long COVID. So rampant. You and I see so many patients. We both practice in New York. You happen to be in the city. I'm just outside. And there are a lot of people that we see both in person and online that have long COVID. And the vagus nerve has been implicated in long COVID, in that 66% of people who have long COVID have a vagus nerve tone decrease. They've seen that by testing the vagus nerve via HRV, that's heart rate variability. The vagus nerve does have something to do with heart speed, heartbeat, and that rate variability. In addition, they've palpated the vagus nerve, or vagus nerves, as you well said, and they found out that there's a thickening. And of course, with the digestive issues that come with long COVID, they've really shown that the vagus nerve is implicated. So it's a key component if you want to treat and help attenuate a lot of the symptomologies of long COVID. So we mentioned the idea of vagal tone. What can people do to maintain vagal tone? Or even better yet, I'll supersede that question. How does this all go wrong, my friend?
Well, it goes wrong by lifestyle, diet, stress. I mean, we live in a crazy, 24/7 kind of thing, constantly getting bombarded. People don't take time to really take care of their own health the way they should, because we're built in, allopathic physicians are great at treating patients downstream. Patient has a disease, they make the diagnosis, they spend thousands of dollars to get tested. And as you've seen in your practice, they come in and say, well, the doctor told me I have issues that might be related to long COVID, but he doesn't know what to do about it. And maybe I should just see a therapist. With functional medicine, functional nutrition, whatever you want to call it, we try and intercede in a patient's health and wellness upstream. We want to identify those triggers, those things that can be leading to problems. So we want to get to the root cause of inflammation. We want to understand the functioning of the gut, whether or not there is permeability in the gut. We want to find out how their immune system is working. What's their stress levels? What's their vitamin and mineral status? What's their hormone status? We want to find out. So when I see a patient, I want to know, why does this 54-year-old male patient coming in, why do they have all of these symptoms that the average physician probably would say they're not related, or I don't treat that? You need to go to a rheumatologist. So you go to a rheumatologist, he puts you on medication, and you get an upset stomach, and now you have to go to a gastroenterologist. Then you get new drugs. Now you can't sleep. So you got to go to a neurologist, or you get other symptoms. We want to look at how we can intervene in our patients' overall health and wellness before they're sick. Unfortunately, with long COVID, they've already have issues. But as you so well said, Dr. Silverman, there's over 200 symptoms that a long COVID patient can present with. So nobody's the same. Everybody's got their own biochemical individuality. And that's why you can't just look up on Dr. Google and say, I should take, alpha lipoic acid or vitamin D, and that's the cure. And which is a crazy term to use anyway, cure. You don't cure anything, you manage it, and that's it, without realizing, well, you can look at your long COVID patients. Do any of them present with the same symptoms? They might have something neurologically, they might have more gastro problems, they might have more cognitive issues, a whole host of problems that I feel can only be addressed by a functional practitioner who looks at the whole issue. And part of that is understanding the vagus nerve and what we can do to control the vagus nerve and bring it back into vagal tone.
Wonderful, outstanding. I concur without question. And I agree with you. The modulation and the balance of the vagus nerve is truly functional medicine, functional nutrition. So let's take a second. People hear us with these terms. Functional medicine was a term coined by Dr. Jeff Bland, mentors to both of us. Wonderful guy. He's been on my podcast. He's going to be coming on again. In that, it's the idea of functional. So some people don't do medicine per se. They want to do functional nutrition. So if we're making this flow chart, it's a tier, but it all comes back to the same thing. And the idea of we want to get to root cause resolution. And we ultimately want all the patients to have better health through lifestyle. And as you aptly coined the phrase or utilized the phrase, homeostasis, the balance in all the systems. Now, vagus nerve is also a backdoor way to talk about longevity. Longevity is the incisive topic of conversation of 2023 right. and beyond. And that's great. And for you and I, chiropractors, we do believe in the idea of functional neurology, functional nutrition, functional medicine, functional movement. The vagus nerve truly captivates that theme for both of us. So obviously, vagus nerve tone is critical. How can they keep vagus nerve tone, or at least appropriate vagus nerve tone?
Okay, so there are certain things that we know or have been shown in the literature: singing, humming, gargling, immersing yourself in cold water has been shown to be effective. Certainly getting enough sleep has been shown to impact the vagus nerve. But then there are also electrical ways that we're going to discuss. But certainly also in addition, I think diet is important. Obviously, we know that eating a refined, high carbohydrate diet versus a more plant-based type of diet that has the essential fats, which is always a topic of conversation. Good fat, bad fat. What should your diet be made up of? Certainly having a diet that's very high in bioflavonoids. So my breakfast always in the morning is cereal, raspberries, blueberries, blackberries, pomegranates, which seems to be the new kid on the block now, pomegranates, because of their possibility. But also meditation. I always tell my patients, get a life, get a hobby. You got to find something to do. I was just consulting with a woman this morning, a long COVID patient. I said, look, you have to find something to do. You have to find something that makes you happy. You have to move forward. Now that you're feeling better, you can't let the thinking of maybe this is as good as I'm going to get. It's a marathon. It's not a sprint. It takes time to deal with these issues because patients come in all the time. How long is this going to take? You know, whereas if they went to a physician and the doctor said, I'm putting you on Lipitor, you have high cholesterol, the patient would walk out and say, well, I'm taking this for the rest of my life. If you put them on a vitamin or a complex, you know, set of supplements, a month, what do you think, doc? 2 months? And I was like, no, this might be a lifetime to deal with the issues that you're dealing with because for whatever reason, genetically, and now we're able to do that, look at people's genes and see what their weaknesses are and support that. This is an ongoing process. It's not something you do for 6 months and then, okay, I'm in the clear. I mean, could you imagine taking Lipitor or any drug for 6 months and then say, I really feel good, I'm just going to stop it? It doesn't happen, but there's something about taking responsibility for your own health and well-being that kind of gets people, I don't know, it's easier for them to take a pill. It's easier to say, oh, just 3 times a day? Got it. As opposed to, no, you have to do these things. So certainly humming, singing, laughing, gargling, going in cold water, meditating, exercise, all is a way to, and certain breathing exercises that are very simple to do. I mean, I have my patients, they lie on their back, they look up at the ceiling, they take in a deep breath, and as they're doing that, they turn their eyes to the right. So they're looking up like at an angle, and they hold that for about 30 seconds. Then they do it to the left side, do the same thing. And some patients will say they feel something relaxing. They feel something different going on. And that's a very common, because deep breathing has an impact on the diaphragm, which, guess what, is innervated by the vagus. So if you learn to, you know, breathe, taking a deep breath and, you know, not get so crazy about what's going on, that will reset the tone of your vagus. And the real exciting stuff is the electrical.
Yeah, we're going to jump into that. I know you've been saving the best for last.
Oh,
so without question. So let's unpack a lot of what you said. So what's great about it is that there's a tremendous amount of lifestyle hacks that can help balance and stimulate the vagus nerve for better health outcomes, breathing, meditation, better choices in diet, keeping the carbohydrates. Just remember, there's 2 essential macronutrients, fats and amino acids. There's no carbohydrate that's an essential macronutrient. Most of the time, carbohydrates get transformed into sugar or come in as sugar. They're very detrimental to one's overall health. The breathing is critical. I employ a physiological sigh, which is 2 short breaths and 1 long breath. It's a breath that rangers and SWAT officers use when they're under fire to calm down. But stimulating the vagus nerve, I just wanted to add something that I think that people will find tangible. The vagus nerve actually is about 80% afferent up from the gut to the brain and about 20% efferent. Efferent fibers in a nerve relay really employ the gut to brain axis. They transmit information about pain, inflammation, satiety, sense of fullness, motility, presence of toxins and irritants, intestinal barrier integrity, which is what you talked about before, and the overall microbiome. Afferent, going back down about 20%, actually affects signals coming from the brain to the gut. They actually modulate digestion, gut motility, hormone release, and neurotransmitters. Both of those pathways are anti-inflammatory. So any kind of stimulation to the vagus nerve is an anti-inflammatory stimulation. But here may be the secret sauce. We all know what a spleen is. A spleen is a respite for immune cells, macrophages. Well, when macrophages are combined with decreased vagal tone, have a release of NF-kappa B, a signal transducer of inflammation in the body, we need to block that. The vagal splenial nerve pathway, so the vagus nerve combines to the splenial nerve, and that actually releases what we call acetylcholine, stops the signal for NF-kappa B, and allows the immune system to function well by releasing macrophages. That's a third pathway. So in summation, by stimulating the vagus nerve, there's three pathways that you can provide anti-inflammatory properties to the body. That said, how would you recommend stimulating the vagus nerve?
Okay, well, I just want to talk about something that you said, which I totally forgot about. The important role that the vagus nerve plays is in anti-inflammation, in the sense of working with the spleen, because people think, well, it's like the appendix, it's not important. It's so important because macrophages, these white blood cells that really just go around and are a major portion of our immune system, have receptors for this chemical that is the receptor site for acetylcholine. So acetylcholine is the neurotransmitter of the parasympathetic nervous system. So many years ago, they started to look at, which is not something you can do, but it's not we can do, implanting almost like a pacemaker where they would wrap fibers around the vagus nerve. And what they began to realize that a lot of symptoms that patients were presenting with, because they were so much in sympathetic dominance, would calm down. Then they investigated and looked at, can we stimulate a branch of the vagus nerve in the ear, the auricular nerve, by putting a simple TENS unit with clips, which you could get in Amazon, because what they found is the fibers in your ear that stimulate the vagus, it's only about 1 or 2%. Whereas you have along the right side of your neck, or along the carotid sheath, so almost underneath the muscle that sticks out in your neck when you turn to the right or left, the right side is about 200,000 fibers. The left side is 100,000 fibers in that area. So perhaps using a device specifically over that and stimulating the carotid sheath of the vagus nerve, because it's entrapped, like you said, may have a profound effect. Now, I've been using the TENS unit and seen some interesting results. I now just purchased a vagal nerve stimulator to be used in the neck region, and we're going to see how that works with patients. And we're talking about results for irritable bowel syndrome, headaches, which is a classic for vagal nerve stimulation, sleep disorders, a whole host of things, gastric problems, because you said the vagus nerve affects that. And I think added to this is the interesting insight that in some patients who have vagal nerve dysfunction, perhaps the use of antihistamines might be good, either an H1 or an H2. So a report just came out last week about using Zantac, giving patients Zantac to control the function of the vagus nerve. So I've had a couple of long COVID patients, and one of their primary complaints was dizziness, severe dizziness. And I used ginkgo biloba and alpha lipoic, some of the more classic things. And I just said to these patients, why don't you just go in a pharmacy, buy Zyrtec, an antihistamine, and their symptoms improved by 60%. Just doing that, which kind of like, whoa, that kind of blew me away. So let me go back into the literature and read some more. And there's a lot of research now looking at possibly using this as a treatment in patients with the vagal nerve dysfunction, or even in long COVID patients. But that's way down the track, because as you know, Dr. Silverman, the things that we do that physicians don't do is remarkable, the results we can get. And I've played around with like colite laser therapy over the vagus to see if that matters. I haven't seen much results with that. Maybe you have, but I haven't seen any true benefit.
Well, you
And
kind of served it up for me. I appreciate that. But let's I want to reiterate one thing that you said that was critical, in that the auricular vagus nerve, a part of the vagus nerve, comes up through the carotid sheath to the ear. It's only about, like you said, 1/100th of the length of the vagus nerve, but has more nerve fibers than any other part. That's why you want to attempt to stimulate it. That's a great takeaway. There's data that indicates that stimulation of the auricular portion of the vagus nerve has decreased certain ASD issues, is now a point of reference for autism. For me, I'm a laser guy. And again, it depends what utilization of the laser you have. I have found that using the corneal laser, I mean, I'll just say it, has been a breakthrough for me in stimulating the vagus nerve. As a matter of fact, there's the first one out of the speakers to utilize that. So I found it to be extraordinarily effective. It's the way to go, in conjunction with everything else we talked about. So, you know, you want to have a specific protocol, and at a later date, I will go through the protocol. You can also add to some of the things that we talked about. You would add some vagally mediated probiotics as well, be long gum, Lactobacillus acidophilus, bifidobacterium, bacteria, L. raminosus. As a matter of fact, there was a study with L. raminosus. They actually had mice, and this is wild, had ASD. Never knew that they could. They gave them L. reuteri and L. raminosus. And in that, their ASD virtually went away. It was virtually gone. They did a vagotomy. They took the vagus nerve out, still gave them the probiotic, and guess what? All the symptomology came back. So it just shows the tone of the vagus nerve, what you and I have been talking about, is critical for overall health. Short chain fatty acids like butyric acid is a key component. Fiber, increased bile flow, omega-3 fatty acids, and some of the hacks that you talked about, sleep, when we could spend a lot of time on intermittent fasting. And one of the key elements that no one really talks about enough is L-citrulline, but these are all additional lifestyle hacks. So if you want to put it all together, could you give 5 things that you would recommend to our listeners that they should adhere to have a better vagus nerve tone?
Okay, number one, most importantly, get on a good probiotic. Because if this communication is going on, and I think you can't look at the numbers. I have patients, I'm sure you do, they come in, I bought this 250 billion CFUs, colony forming units. I bought this at Costco. What do you think of it? And the problem with most probiotics is they don't even get to the gut. They get broken down in the stomach. So 250 billion doesn't really impress me much. I think most patients should be taking a spore-based, plant-based probiotic. That's only, because they'll say, wow, that's only 3 billion. I got 250 billion here. And it's like, well, that doesn't matter. So I think that's really important when you're dealing with the vagus nerve. Understand what might be some of the triggers and learn to deal with those. And number one, for a lot of people, if your gut isn't working right and you're not digesting and absorbing and have permeability, you're going to have inflammation. You got to address that. What's the inflammation coming from? Is it coming from food? So the lining of your gut is becoming inflamed all the time. Is it gluten? Is it wheat? Is it dairy? What are you eating that might do that? You might want to support the the covering of the gut, the mucous membrane lining. I think that's important to look at. And if you're going to look at the gut, sleep, because the two are related. Look, the circadian rhythm, and not only the circadian rhythm of an individual, each organ has its own circadian rhythm. So, dealing with that. learn to relax and find something, meditation, or do those breathing exercises and singing and humming and dancing and doing whatever. I think those are important for the vagus. And I think a simple investment, if your doctor knows about it, is talk to them about getting a TENS unit and starting to experiment. It's not, I mean, it's not hundreds of dollars. It's TENS units are very affordable. The clips on Amazon, I think, are $12. So that's a very easy thing to do. So I think there's a number of things there. Balance your diet, get on a good supplement program specifically designed for your complaints that you might be experiencing, because everyone's different. But I always start with healing the gut, the typical 7R Dr. Bland approach, re-inoculating the gut, healing the gut, replacing any missing bacteria, trying to reduce inflammation, whether you're going to use vitamin D, turmeric, quercetin. I'm a big quercetin fan as a bioflavonoid. Glutathione is very important. You just need to sit down with someone who is trained in doing it, not like I say, just looking at Dr. Google, because I get all kinds of stuff, and I'm sure you do. They come in with papers. I saw this. I got a mailing. This is the greatest stuff. And it's like, you don't need it. How much stuff do you want to take? I mean, I've had patients come in. I don't feel well. I've gone to my doctor. He's done all these tests. This is the typical patient. I don't feel well. I feel really shitty, if we can say that on a podcast, or you're going to knock that out. I've gone to a doctor. All my tests are normal. Oh, so what supplements do you take? And they have 2 shopping bags. I take 72 supplements a day. And, you know, my first response is, you really don't look that sick. What are you trying to accomplish with 72? So you really need to sit down with someone who is certified in nutrition, who might hold a diplomate status in nutrition, someone who really listens to you, because that's part of the game, listening. I used to come home from practice and say, I wonder why I'm so tired. And then I realized, from listening so much, because the patient knows what's wrong, and they'll tell you, what's wrong? My stomach hurts. Okay, I got to work from the premise, this person's stomach hurts. I'm not going to give them a lot of gibberish. I agree, your stomach hurts. Why does your stomach hurt? Let's work from there. So Great I think stuff. That's a good approach in terms of the patient knows why they're in the, what's wrong. You're the guy that needs to create the roadmap, the Google map of how you're going to approach that patient's symptoms. Each doctor will have their own. It's, you know, if you go to an orthopedist and you have low back pain, they're all going to do an MRI. If you go to a functional medicine doctor and you have low back pain, each one might have a different tool to access or to look at how they would treat you based upon a lot of different things. Same results, but you know, just a different approach. So the patient has to find the doctor that listens, that answers their questions, that is really concerned, not this 10-minute in and out, call me in the morning. That's no good anymore. Very complex cases require complex practitioners. I guess that's the best way to put it. You're a complex practitioner.
Thank you.
Because you get it. You get it. You're not there, oh, just try this. Maybe you'll feel better. Because that's what patients do. They go in the health food store. My nails are broken. What should I do? Okay, take biotin. Okay, what does that do? Do you know why you need it? Do you need it? No, the guy said, who's like a high school, you know, and then he comes to us with how many years of experience in clinical training and certification and says, I'm taking biotin. What for? Oh, the guy in the health food store told me.
Yeah, I hear you on that. I mean, that's
I mean, that's a story unto itself.
Correct, without question. And I believe that the conditions are more complex and they need a complex practitioner, like you said, someone who's functionally medicine trained. Chiropractic orientation is a great starting point. And as it's been said, the more complex the mind, the more simplistic the answer.
Mhm.
Einstein once said, it's truly simple when you really understand it. So that's why you always want to seek out a practitioner who has some experience and has some training and clearly knows something about that vagus nerve. So within that, I just want to say it's been great. I learned a boatload from you today, wrote it down.
Great.
I'm going to reuse it. So, I'll give you full credit if you're lucky. And
No
I look
credit
forward to,
necessary.
yeah, I look forward to seeing you again.
Great.
It's been my pleasure. Everybody,
Thank
Dr.
you so
Bob
much for
Silverman,
inviting me.
my pleasure, Dr.
All
Howard
right.
Benedikt. We are Proven Health Alternatives.